Here's a story of a news report of a 25-year-old man who jumped off a building. You will be saddened to hear that, but it's not a surprise to you to hear a story like that. The truth is that suicide has become a common occurrence in our society. Statistics tells us that between the ages of 15 and 34, the second leading cause of death is suicide. This is the reason the story is not surprising. But what if I told you that the 25-year-old man was a junior psychiatric doctor from one of India's prestigious medical schools, the AIIMS, and that the building was a hospital? There is an automatic response that no suicide makes sense, but that of a suicide of a 25-year-old psychiatric doctor jumping off a hospital building makes absolutely no sense. Dr. Pamela Webbles studied 11,000 physician suicide and dedicated her career to ending and decreasing physician suicide. So here are some of the facts from her studies. She says, physician suicide is a public health crisis. 1 million Americans lose their doctors to suicide each year. Many doctors have lost a colleague to suicide. Some have lost up to 8 during their career with no proper opportunity to grieve. We lose more men than women to suicide, and patients' death hurt doctors a lot even when there is no medical errors. Doctors who need help the most don't seek it because they fear that mental health care won't remain confidential. Pamela says the most important thing a physician can do is to share your story. Let people know the struggles you've gone through, whether it's the small, simple little problems or the very large emotional and life-threatening problems you've had yourself. Let people know it's okay to share their stories and their struggles. So here is my story. I'm Aarti, a psychotherapist. I help people create happy, healthy relationship. Suicide has never been a stranger to me. At age 8, I missed the opportunity to say the last goodbye to my mother. She suicided. There was not a drop of compassion in me. I was too hurt and angry for any other emotion. All mothers love their children, and that's the law of nature. The fact that my mother had run away from me only proved that there was nothing in me to love, something terrible, something wrong with me. And that feeling was truly horrifying. And these were the thoughts of a sensitive, intelligent child that I was. Fast forward to now, I love my mother and God bless her soul. She was a beautiful woman. I stopped being addicted to my old story and justifying it. I realized suffering is not in the facts, it is in the perception of the facts. Now I know there is a greater plan larger than myself, and I'm honored to live my story every day. I've spent nearly every waking moment on a personal quest for the truth of why a person suicides. Was it financial problems, marital problems, health, depression, bipolar, or addiction? And of course, suicide doesn't affect only the rich and the famous. Most of us are likely to know or love somebody who has been affected by suicide. It's a common misconception that depression is the culprit behind suicides. While depression is a contributor, it's not the main reason people kill themselves. I'd like to share with you a leading theory by Dr. Mark Goldstein, who specializes in suicide, and he stated that 8 feelings that contribute to suicide are hopelessness, helplessness, useless, worthless, purposeless, meaningless, pointless. As a licensed mental health therapist, I'd like to share with you 2 tools called interventional empathy that I use in my practice. So, step number 1 is sit with your loved one who is in a dark place and engage them with any of the 8 feelings mentioned above. It can lead to a more dynamic, engaging, and expressive conversation. When the distressed person begins to express and describe what any of those words mean to them, they will begin to experience those feelings versus experiencing nothing at all. And they will start to feel a sense of relief as they sit with an empathic person listening to them. Here's tool number 2. Step 1 is sit with the suffering person and begin speaking to them enough to make a connection. And then say 7 words. This causes them to stop and be temporarily confused, which will temporarily break the vice grip holding on feeling suicidal. And they will often respond with, "What?" Step 2. Then say the 7 words: hurt, afraid, angry, ashamed, alone, lonely, tired. Ask them to pick one and start telling you about it. Presenting the 7 words in such an assertive manner will often cause people to spontaneously begin expressing those feelings, feeling less alone, crying, feeling relief, and becoming more open to conversation that may cause them to consider other options otherwise. If you or someone you love needs help, call 911 or call the National Suicide Prevention Lifeline.